So, care of the older client, chapter name. So, in this chapter, we are going to discuss about how to take care of the older person. And also, we are going to know what are the change occur because of aging, right? Physiological change, psychological change, all take place because of aging process. In the first phase, they said aging and gerontology means the subject discuss about the old person. Aging is the biopsychosocial process. So aging is a bio psychological. So aging has a effect on your mental health or psychological health, your social behavior process, and also our bio uh, chemical means bio means something living organism. So because of aging, our cell also take place some change, go through some process of changing. I want to give you an example. So as an example, like the cell can produce ATP by metabolism, but because of the aging, the cell metabolism change, right? Cell metabolism system is changed. So that occur in a person between birth and death. So the subject where we study, where we everything maintaining the process, aging process, this is called genotology. It is called the genotology. So aging is okay. Aging is the biophysiological process we said. So the subject where discuss the aging process, the study of the aging process is called gerontology. So here, what are the change occur in system by system? Like physiological changes, intragumentary system. So in our intragumentary, leg, skin, then hair, nail, including this is called the intragumentary system. What change take place in intragumentary system? So basically, loss of pigment in the hair and skin. Patient develop wrinkling, very natural. Thinning of the epidermis. So epidermis is a layer, outer layer of the skin, right? The thickness of the epidermis is reduced and skin will be thin. And when skin will be thinner, the people will look like older. And also the older person is easily bruising on the skin, easily tearing the skin. For that, we need to take care of the patient, elderly patient. Like if you do not bed make, patient develop the breakdown of the skin, and breakdown of the skin lead to the ulcer formation. And this ulcer also take time to healing. So aging is an important factor. Decrease the skin trigger, skin elasticity loss, subcutaneous fat also reduce. So thickness of the skin, basically because of the collagen tissue, and also thickness of the skin depends on subcutaneous fat. But unfortunately, when we are getting older and older or aging process, the collagen tissue reduce in the skin and skin look like thin, and subcutaneous tissue in the skin also reduce, and so we look like older. Increase the nail thickness, decrease the hair growth. Unfortunately, we do not need this. We do not need the thickness of the nail. We do not need to increase the size of the nose, increase the size of the ear. But because of aging process, you see the person nose shape will be changed. Ear will be little bit bigger. Foot will get bigger. I mean, I'm talking about the size. But we do not need the nail thickness. We do not need to change the shape of the nose or ear or foot, right? But because of the disease process, it will be happened. Also decrease the hair growth, decrease the perspiration, and dry, itchy, and scaly skin. So older person sometimes complain the itchy on the skin because the secretion on the skin reduce, skin will die. Because of the dry skin, pruritus or itching developed, and also the seborrheic dermatitis develop, keratosis formation, overgrowth of the thickening of the skin. So what the other system like neurological exam? So slow the reflex in the body, slight tremor, and difficulty with the fine motor movement. So slight tremor or fine tremor, difficult with fine motor movement. What is motor movement? Motor means muscle. So loss of balance, so equilibrium problem, and increased incidence of weakening or increase the susceptibility to hypothermia or hyperthermia. Short-term memory may decline, short-term. Long-term memory usually okay. So what is the difference between short-term and long-term? So short-term means like if I ask the old person what you ate yesterday breakfast, what kind of breakfast you have taken yesterday morning, maybe they forgot, and this is short term. If I say what you ate today morning, they forgot. But if I say, can you tell me what are the city name you was born, they can answer. This is a long term. So because of aging process, short-term memory decline, but long-term memory most of the times intact. But if the patient has a dementia, maybe for Alzheimer or Parkinsonism, that times both memory will be get impaired. Here showing a picture. This is the normal, healthy, young person brain. But here showing the brain tissue going to smaller or shrinking, right? And the ventricle, this is the ventricle. Ventricle or vacuum will be increased. And this is a normal healthy neuron. Neuron is a tissue of the brain. But in the older person, neurofibrillary uh, triangle developed. Amyloid body sometimes develop. Amyloid plaque formation. And also you can see the big ventricle increase the bigger in size because the total mass of the tissue reduce. So this is a normal healthy person brain, and this is the elderly person brain. Because of that time of degenerative change take place, patient develop Alzheimer or other degenerative disease like Parkinson's disease. What are the changes take place in musculoskeletal system? Musculoskeletal system, muscle mass and strength reduce. Muscle mass and strength reduce. Muscle atrophy develop. Muscle atrophy, why? Because elderly person do not use their muscle. Decrease mobility, range of motion, flexibilities, coordination, also change the gait, right? So gait means movement, walking pattern change. Also posture, stature, posture change. And also the height because of osteoporosis or different kind of osteo disease, bones disease, especially osteoporosis, that reduce the size of the brain. So here, increase the brittleness of the bones, easily broken the bones because of lack of calcium, lack of phosphorus, lack of magnesium. Also, patient develop the kyphosis. Kyphosis because of deviation of the spinal cord. Patient develop lordosis. The older client is the risk of fall. So if you go in the, if you work with a rehab center for older person, you can see more than 95% accident occur because of fall. So older client is at the risk for fall because the change that occur in neurological and musculoskeletal systems. And also the physiological change, cardiovascular system, diminished the energy, cardiovascular means heart and blood vessels, diminished energy, decreased compliance of the heart muscle, heart valve become thicker and more rigid. So a heart valve is become thicker means they will not be flexible. They does not squeezing. They get rigid, and they causes the obstacle or obstruction of the blood passing. Also, because of the aging, the cardiac output decrease the efficiency of the blood return, decrease the compensatory response, no less able to respond to decrease the demand of cardiovascular system, and decrease the resting heart rate, weak peripheral pulses and decrease the blood pressure, but also susceptible to the postural hypotension. So you see cardiovascular everything decrease energy, decrease the compliance, decrease the cardiac output, decrease effective of blood return to the heart, decrease the compensatory response, decrease heart rate, resting heart rate, and also weak peripheral pulses, increase the blood pressure, but susceptible to postural hypotension. So blood pressure increase, but when patient change the posture, blood pressure drop, and this is called postural hypotension. So because of the aging, increase the chance of postural hypotension, but patient will be hypertensive. Why? Because the atherosclerotic change, because the thickness increase in the artery, heart get weaker, does not pump well, peripheral return will be reduced, right? So what else? What are the change place in the respiratory system? Decrease the strength and also function of the respiratory muscle, decrease the size and number of alveoli. So alveoli are the unit of respiratory system, respiration, alveoli. Nephron are the unit of the kidney, right? So respiratory rate usually unchanged, but the size and number of alveoli reduce, and also decrease the depth of respiration and oxygen intake, decrease ability to cough and expectorate sputum. So this type of change take place in case of a respiratory aging process in respiratory systems, right? And what next? The hematological change, immune system change. Hematological system like hemoglobin and hematocyte level average towards the low and normal. So hemoglobin and hematocrit. So hemoglobin means this is the globin, iron contain globin inside the red blood cell, and hematocrit are the total volume of the blood corpuscle. So both are reduced, or hemoglobin or hematocrit level average towards the low or normal, prone to increase the blood clot. This is the reason healthcare provider prescribe the anticoagulant like heparin, warfarin, or aspirin. Decrease the protein available of the protein bound medication. Immune system, tendency for lymphocyte count to be low and decrease the resistance to infection, because if WBC, other WBC is several type, lymphocyte is one of them. So if WBC reduce, patient easily get infected by the infection, right? Or bacteria or any other pathogen. What are the change place in gastrointestinal system? So decrease the need for calorie because the lower the basal metabolism rate. So because the aging process, the metabolism go down, metabolism system. So if the metabolism go down, or body can produce less ATP, decrease the appetite, decrease the thirstiness, decrease the oral intake, or decrease the lean body mass, decrease stomach emptying time. So this is the reason elder person um, feel less hungry rather than the young. Increase the tendency towards the constipation, because elderly person bowel does not move at as like as a young person. So this is the reason constipation develop. So you have to educate them, or you have to tell them to take food containing the fiber, and enough food contain the fiber, and enough water intake, at least 2 liter to 3 liters per day, or 2000 milliliter to 3000 milliliter per day. Increase the susceptibility of dehydration. Okay, so always make sure your patient has to be rehydrated. If they dehydrated, you give them fluid and help them rehydrate. Difficult with the chewing and swallow food, especially if you work in rehab center, older care person, you have to make sure patient when eating, they are sitting position or upright position. And also make sure the deglutition or swallowing is well. Otherwise, chance of develop aspiration. So what else? Endocrine system. In endocrine, what change take place? Decrease the secretion of the hormone with specific changes related to each hormone function, or decrease the metabolic rate, and also decrease the glucose tolerance with resistance to insulin in peripheral tissue. If decrease the glucose tolerant test, so why? Because resistance to insulin. Insulin does not work well. So if insulin does not work, the glucose does not metabolize and increase the blood glucose level. All right. So the renal system, decrease the kidney size, function, ability to concentrate urine, decrease the glomerular filtration rate, shortly called GFR, decrease the capability of bladder, and patient, because of this capability reduce, patient develop frequency, urgency, hesitancy, sometimes dribbling. Decrease the residual urine and increase incidence of infection, and also impair the medication excretion, impaired medication excretion. So liver does not work well, and also kidney does not work well. So medication does not excrete well from the body. It is very important. Otherwise, patient develop, if you do not adjust the doses, if you does not follow the prescription, patient has a chance of develop toxicity. So reproductive system, what else? Reproductive system, decrease testosterone production and size of the testes. So the production of testosterone means testosterone hormone production, right? It will be reduced by the aging process. Change in the prostate gland. So sometimes prostate gland is size will be get bigger and causes obstruction of the urine flow, and this is called benign enlargement of prostate. Decrease the secretion of hormone with cessation of menses or menstruation. Vaginal change include decrease the muscle tone or also decrease the lubrication. Impotency developed or sexual dysfunction of both gender. Sexual function varies and depends on general physical condition, mental status, and medication as well. Like beta blocker causes impotency, right? Also, so many medication, especially psyche medication, causes impotency. So you have to know what is the patient age. What else? What are the change take place in spatial sense? Means ear, vision or eye, and smell, nose. So decrease the visual acuity. Visual acuity go down. Decrease the accommodation of the eye. Accommodation of the eye means the capability or adjustment part of the eye muscle or for the vision, near or long vision. Decrease the peripheral vision, presbyopia developed, or patient develop cataract. In this picture, showing the cataract, the milky appearance of the lens. Okay, this lens does not see well, and it means the surgically remove it. It's called cataract operation. So, inability to decrease the taste of the food, decrease the smell, and also change the touch sensation, and also decrease the pain awareness. So this is the change take place during the aging process in case of special senses. What are the psychological condition of them? So adjustment to deterioration in physical and mental health and well-being. So it is very frightening, right? Mentally they has to fight. They go under depression because a person who are young, looking good, enough strength, but because of aging, it is difficult for them to coping with the bodily change. So threat to independence to the function. So they has to depend someone upon someone to movement. Pathetical, very pathetic, but it is universal truth. We will be the older and fear to become a burden to the others. So adjustment to retirement and loss of income and also loss of skill or competency develop, coping with change in the role of function and social life, diminish the quality and also quality relationship or coping with loss, dependence on government or social systems, and also they need the social support, right? What are the other mental status? What are the other mental status? Patient easily develop the depression because of aging. Depression did increase the dependency that older adult may experience, can lead to hopelessness or helplessness. Also lower the sense of self-control and decrease the self-esteem or self-worth. And this change can interfere with daily functioning or lead to depression. So also they have a fear of isolation. So many families, the older people do not stay with them. They send them in the rehab center, right? So isolation, client is alone. When they're in isolated, they feel alone and desire to contact with others, but is unable to make that contact. And technologically, they are not so faster like the young. And also sometimes some client develop the thinking for the suicide. Depression can lead to the thought of self-harm or suicidal ideation. Depression differ from delirium and dementia. Delirium and dementia. Any suicidal threat from older client should be taken very seriously. And as a healthcare provider, what you should do, you have to make sure somebody always with the patient. So pain, older patient, older patient sometimes feel the pain, and pain, they are very sensitive, and the pain sensation increase. So pain can come about from numerous causes and most often occur from degenerative change. Degenerative change in musculoskeletal like osteoporosis, osteoarthritis, or any other musculoskeletal change like gout, right? The nurse need to monitor the older client very closely for sign of pain. Failure to alleviate the pain in older client can lead to functional limitation that affect the client ability to the function independently. If a patient have a pain, what are the data or sign and symptom you have to collect? You have to collect the sign symptom like restlessness, verbal reporting of the pain, hesitation, crying. So sometimes patient if does not have a tolerate power, they cry. So their facial expression is important indicator of the pain. And also we can use for the pain measuring scale or face scale. So if the pain is 8 out of 10, you have to do something for the patient. Painless, right? So we will try to motivate them. We try to divert their concentration, relaxation therapies, massage therapies, pain medication, right? All is very important. So intervention when patient have the pain, what are the our roles if patient feel pain. And I told you, elderly patient or rehab center, or if the patient waiting for hospice for dying. So whatever it is, always we try to make sure painless death, right? Little bit peace before die. Monitor the client for the sign of pain. Identify the pattern of pain. What nature of pain? Is it burning? Is it stabbing? It is aching. Identify the precipitation factor. You can ask them, can you tell me when pain increase? Can you tell me what when you have pain, what you do and pain will reduce, right? Monitor the impact of the pain on client activities of the day. Definitely, pain can interrupt your performance, and pain can interfere with your concentration. Provide the pain relief through the measures such as the distraction, relaxation, massage, and also biofeedback. Administer the pain medication as prescribed. Instruct the client in their use. Also, evaluate the effect of pain reduce measurement. What next? Infection. Infection also very common problem in old elderly person. So confusion basically is a common sign of infection. Confusion, because if infection is not treated, they can interfere with the sensory or nervous system. So common sign of infection is the older adult, especially infection in the urinary tract. So urinary tract infection is the nature of the infection is a retrograde direction. So maybe infection started from the external genital organ, then this spreading for urinary bladder through the urethra, then the kidney. And when kidney is infected and kidney does not work, the waste materials is accumulated in the body, and the waste materials then enter to the brain and increase the nitrogen product in the body, ammonia, and patient in impairment of the nervous system or nervous function or brain function, and patient get confusion. Careful monitor the old adult with the infection because of diminished and altered immune response. Non-specific symptoms may indicate illness or infection. Medication. Next, go for medication. Major problem with the prescription medication include adverse effect, right? Adverse effect is important. You have to know what medication you are giving and what are the possible sign and symptom of the side effect. If you do not know, how you will be aware about that? Medication interaction, because older person has to take so many medication. So if you do not know what medication will interact with what, it would be difficult. Medication error, most common error in the hospital, medication error. Non-compliance, then polypharmacy, so many medication for the patient. Also for information of medication to avoid in older adult client, This information is based on some criteria, and it's called American Geriatric Society. Information on this criteria and full list medication to avoid, right? Also determined the use of the over-the-counter medication. So in case of extreme ages, age person, extreme means extreme old or extreme young. Both cases, you can't give them over-the-counter medication because this over-the-counter medication causes a big problem for the patient. So there are one link we left. You have to go in the Google. You can Googling and you can read this journal. So you can get some information about medication error. Polypharmacy. Easily, I told you the older person has to take so many medication, right? And this is like I said, if patient heart related any problem, they has to take hypertensive medication, they has to take the cholesterol lowering medication, they has to take the blood thinner, they has to take the any other medication like aspirin, they sometimes complain of indigestion, they has to take the GI medication like proton pump inhibitor, sometimes they complain of the pain, they might be take acetaminophen or any other NSAID. If patient has any osteoporotic problem or if patient musculoskeletal problem, they has to take some calcium, vitamin, and also phosphorus, zinc, right? I'm not talking about the other particular problem because different patients have a different system involvement diagnosis. But as example, if a patient has to take every day 5 to 6 medication, it is very important you have to know what medication has a chance of interaction, drug interaction with the other medication. And even you have to know what are the side effect of each and every medication. So if your patient have any side effect develop, you have to inform to the healthcare provider, you have to stop, right? And then take the measurement to prevent the side effect. And whatever we do, always keep documentation, right? Because good documentation can help you. Good documentation is safe for your patient, and good documentation also easy for your co-worker. They can come in your shift, they can read, and they can get easily some information about the patient. And I want to recap it. Extremely elderly or extremely young patient, both are dangerous. You do not give them over-the-counter medication. The both cases, their liver does not work well, their kidney does not work well. So if the medication is little bit overdose, the medication can cause drug toxicities, right? So you have to be concerned when you're dealing with elderly patient, when you deal with very young patient. And what next? Routine monitor the number of prescription. Keep the use of medication to a minimum. Nobody like to take the medication. Nobody like to take every day 5 to 6 tablet. Over prescribing medication lead to increase the problem, right? Problem about what? Side effect, interaction is called drug interaction. Duplication of medication diminish the quality of life, also chance of develop dependency, also the cost. Medication dose normally are prescribed at 1/3 of the half of the normal adult doses. Continue the medication error. we have to closely monitor the client for the side effect and adverse effect, and also response to therapy because of increase the risks of toxicity. As I told you, digoxin, sometimes patient has to take for heart problem. So digoxin has a very narrow therapeutic index. So you have to, when you give the patient, you has to monitor the blood level of digoxin to prevent the digoxin toxicity. Not only this, you also should monitor the blood electrolyte levels, especially potassium and sodium. And sodium, when go to less than normal or hyponatremia, is a precipitating factor of digoxin toxicity. Not only this, when you give the digoxin to the patient, you have to monitor their vital sign, especially heart rate. If you get the heart rate less than 70 or 60, you have to hold the digoxin. You have to contact with the healthcare provider and check the medication interaction. Another one, advise the client to use one pharmacy and notify the counseling pharmacy healthcare provider for medication taken. A common sign of an adverse reaction to a medication in older client is an acute change in mental status. Safety measure for administration of medication, right, is a very important priority for the patient. Place the client in a sitting position when you give the medication. Check for mouth dryness. Decrease the medication may stick or dissolve in the mouth. Admit the liquid preparation and also crush the tablet. There are some small device is available. It's called tablet cutter. So if necessary, use it. Enteric coated tablets. Some of the tablets are covered by a thin layer. Okay. So this is called enteric coated tablet are not crushed out. Capsule are not opened, right? So safety measure for admin the medication. Safety measure for administration of medication. If administration is suppository, avoid inserting a suppository immediately after removing from a refrigerator. So usually suppository, like suppository for the fever, suppository for the pain, or any other suppository, even glycerin suppository for constipation. So usually suppository we have to keep in the refrigerator, but when you apply to the patient, don't use directly from the refrigerator one to the patient. Better to make a room temperature. After waiting, you have to do it. You have to give it to them. A suppository may take a while to dissolve because of decrease the body core temperature. When they admit the parental nutrition medication, what does it mean? Parental. So if you give medication any route except orally, it's called parental route, right? So monitor the site because it may use the medication or bleed as a result of decrease the tissue elasticity. Monitor the client compliance, right? It is very important. So safety measurement for medication, which is the continuation of it. Monitor the client for safety with regard to correctly taking the medication. Include an assessment of the client ability to read the instruction and discriminate among the pill and their color and shape. Use of medication cascade to facilitate the proper admin of medication. So also abuse of older person. So older person have a chance of abuse, right? It is important. You have to find out your patient is going to any abuse or not. So domestic mistreatment take place in the home of older adult and usually carry out by a family member or significant older. This can include physical or negligence, right? Or abandonment. So a question sometime NCLEX board asks, who is the chance of abuse? Answer would be elderly patient. Moreover, elderly dementia patient. So also it is very important when you talk to the patient, better to examine them and find out any kind of abuse mark. When you talk to them, try to counseling one-to-one, right? Or when take to history by the patient one-to-one. If you see something abnormal, you has to notify, right? So older adult experience abuse when hospitalized or living somewhere other than the home, the chance of abuse. Self-neglect is the choice by a mentally competent individual to avoid the medical care or other services that could improve the optimal function, not to care for oneself or engaged in action that negatively affect his or her personal safety. Individuals at the most risk for abuse include those who are dependent because of their immobilities or altered mental status. So if the patient are older, if the patient are difficult to move or immobility, or if patient has altered the mental status, if the patient has a dementia, they have under the risks of abuse. Very important for NCLEX board. For additional information about abuse of their older client. So there are two questions before to finish this PowerPoint here. So let's go and explain it. Which client is most likely the risk because of victim elderly abuse? As I told you, the most extremely older person with dementia or other immobilities or dependent person. So they said a 75 years old man with a moderate hypertension, 68 years old man with newly diagnosed cataract. Out of these two, cataract is okay, but 75 hypertension. What about the number 4 and 3? 90 years old women with advanced Parkinson, 70 years old women with early diagnosis of Lyme disease. So you see, one, she's a 90 years old. Secondly, she's a Parkinsonian disease. So Parkinsonian disease, like a Alzheimer, both have a dementia, forgetfulness. So number three, she's under the threat of, or mostly likely at the risks of abuse. So elder abuse is a widespread and occur among all subgroups of the population. It includes physical, psychological, both type of abuse. The misuse of property and the violation of rights. The typical abuse victim is a woman of age, advanced age with a few social contact, and also at least one physical or mental impairment that limit her ability to perform activity of daily living. So the client usually lives along or with the abuser or depends on a abuser for care, unfortunately, right? So another question, they said, which intervention should be implemented for older client with a uh, praise presbycusis who have a hearing loss? So what are the interventions should be implemented who have this type of problem? Speak loudly, speak slowly, use this low pitch tone, use the high pitch tone. But it is important, if your patient has a hearing problem, if your patient has a vision problem, you have to talk with your normal way of you talk to the other patient. No, so you do not need to loudspeaker, you do not need to low speak or high pitch. You have to go just normal what you do for the other patient. So this disease, the hearing problem, is related irreversible degenerative change in the inner ear that lead to decrease the hearing abilities. As a result of this change, old clients have a decrease the response to the high frequency sound. Low pitch tone of voice are more easy to hear. Also, patient can interpret it by old client. So answer should be low, normal pitch tone, right? So this is the PowerPoint for